All these 5 elite runners, they exchange water just using one water. So it's a physical transmission of this important element of life, the water, and then they kind of throw it off. So the idea is this interaction is so crucial for, in my presentation, I wanted to bring some perspective on this based on the work we have been doing for many years now. So the only thing we know is the expansion somehow offers the extra affinity to this.
And Professor from the Department of Neurology in NIMHANS. All here with us today. Before the lamp
Deva Pashi Ujada Padala Tulasi Pashi Mangalamani Mama Saubhagyacha Deva Maja Maja Uddandalasi Teja
Mr. Venkateshwara Rao Kaushik, Chairman of HDSI, to deliver the opening remarks.
Welcome to this event. It gives me a great immense pleasure to deep pride to welcome you all for the second edition of the Huntington Disease Society Conference being held at NIMHANS. On behalf of Huntington Society, I extend warm welcome to all and gather here today from India and across the world. This year's theme is Advancing the Science and Care, Unified Strategies for Huntington Disease. We thought we'll have an interesting session both towards science as well as the patients, so that it creates the interest of both people in that category. That's what is the intention of this. And we had in 2019 first conference before forming the Huntington Society in NIMHANS itself. And this is the second edition what we have been taking up. And we are on to have for a esteemed distinguished scientists from the healthcare, including Dr. Vijayraghavan, former Principal Secretary, Advisor to Government of India, and Dr. Pratima Murthy, Director of NIMHANS, Suvarna Ladi, and Head of the Neurology Department, and Jagdish Tirthaldi. I think he is not there, I think he will be President as well as scientist from the this thing, Kamal Pal, and as well as NIMHANS, Purushottam, and others, Susini and Bhaim. We have been collaboration and hope.
Looking at advancing the science as well as care. And I think to have it in NIMHANS is particularly symbolic and important, because I guess that's what we do day in and day out. We look at trying to advance science so that eventually it can lead to better outcomes for patients. It's also very good that we have such a diverse group of people present in the audience.
And of the dais. So happy to be part of this, August gathering. I would be sharing few practical discussions what we have had with the HDSI team and NIMHANS team. HDSI team, I'm always, my heartbeat little bit goes up whenever I see Kaushik sir. So we have had many rounds of discussions, actually practically how to help people with HD. So many in the discussions, thanks to our Honorable Health Minister, Principal Secretary, Commissioner. So we have had few rounds of discussion where the team members like Bhavna, Kaushik and Mr. Singh, all of them, they have requested for a multidisciplinary care center where a holistic care can be given in under one roof instead of they going to different places. That is one of the requests that they have put forth in front of the government, and the DBS and various, starting from very practical equipments like different kinds of beds and then wheelchairs. So those practical, difficulties what the
Thank you, everyone. Thank you, sir. Now you should come.
Madam, Shiva, madam.
ಇವತ್ತು ಹಂಟಿಂಗ್ಟನ್ಸ್ ಡಿಸೀಸ್ ಸೊಸೈಟಿ ಆಫ್ ಇಂಡಿಯಾನವರು ಈ ಒಂದು ಇಂಟರ್ನ್ಯಾಷನಲ್ ಕಾನ್ಫರೆನ್ಸ್ ಅನ್ನು ಹಮ್ಮಿಸ್ಕೊಂಡಿದ್ದಾರೆ. ಈ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಅಲ್ಲಿ ಒಂದು ವೈಜ್ಞಾನಿಕ ಒಂದು ದೃಷ್ಟಿಯಿಂದ ಏನೇನು ಬೆಳವಣಿಗೆಗಳಾಗಿದೆ, ಯಾವ ತರ ಈ ತರ ಒಂದು ಜೆನೆಟಿಕ್ ಡಿಸಾರ್ಡರ್ಸ್ ಅನ್ನ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಬೇಕು, ಅದೇ ರೀತಿ ಎಲ್ಲಾರು ಹೇಗೆ ಒಟ್ಟಿಗೆ ಸೇರ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ, ಯಾರು ಈ ಒಂದು ಹಂಟಿಂಗ್ಟನ್ಸ್ ಡಿಸೀಸ್ ಅನ್ನೋ ರೇರ್ ನ್ಯೂರೋಸೈಕ್ಯಾಟ್ರಿಕ್ ಕಂಡೀಷನ್ಸ್ ಇಂದ ಹೊರಲಾಡ್ತಾ ಇದ್ದಾರೋ ಅವರು ಮತ್ತೆ ಅವರು ನೋಡ್ಕೊಳ್ತಾ ಇರೋರು, ಹಾಗೆ ಡಾಕ್ಟರ್ಸು, ಬೇರೆ ತರ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ಸು, ಸರ್ಕಾರ ಎಲ್ಲ ಒಡಗೂಡಿ ಯಾವ ರೀತಿ ಈ ಒಂದು ಕಾಯಿಲೆಗೆ ಸಹಕಾರ ಕೊಟ್ಟು ಸಹಾಯ ಕೊಡೋದು ಹೇಗೆ. ನಮ್ಮ ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಬಹಳ ಕಮ್ಮಿ ಇದೆ ಆಸ್ಪತ್ರೆಗಳು ಈ ಒಂದು ಕಾಯಿಲೆಗೆ ಸರಿಯಾದ ಒಂದು ಮಲ್ಟಿ ಡಿಸಿಪ್ಲಿನರಿ ಕೇರ್ ಕೊಡೋದಕ್ಕೆ. ಅದಕ್ಕೆ ಹೇಗೆ ನಮ್ಮ ಸರ್ಕಾರಿ ಆಸ್ಪತ್ರೆಗಳು ಕೂಡ ತಯಾರಾಗಿರ್ಬೋದು, ಆರ್ಥಿಕವಾಗಿ ಹೇಗೆ ಸಹಾಯ ಮಾಡ್ಬೋದು, ಸಾಮಾಜಿಕವಾಗಿ ಹೇಗೆ ಕಳಂಕವನ್ನ ಕಡಿಮೆ ಮಾಡ್ಬೋದು ಈ ಕಾಯಿಲೆಗಳಿಗೆ, ಇದೆಲ್ಲ ನೋಡ್ಕೊಳ್ಳಿಕ್ಕೆ ಈ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಒಂದು ಮುಂದೆ ದಾರಿ ನೀಡುತ್ತೆ. ಈ ಕೆಲವು ಕಾಯಿಲೆಗಳು ನ್ಯೂರೋ ಡಿಜನರೇಟಿವ್ ಡಿಸಾರ್ಡರ್ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ, ಅದಕ್ಕೆ ಸಾಕಷ್ಟು ಸಂಶೋಧನೆ ಬೇಕಾಗುತ್ತೆ. ಸಂಶೋಧನೆ ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ ಹಣ ಬೇಕಾಗುತ್ತೆ. ಇದೆಲ್ಲ ಒಟ್ಟಿಗೆ ನೋಡೋದು ಬಹಳ ಮುಖ್ಯವಾದದ್ದು. ಈ ಕಾನ್ಫರೆನ್ಸ್ ಅದನ್ನ ಈ ಬಹಳ ವಿಷಯಗಳನ್ನ ಡಿಸ್ಕಸ್ ಮಾಡಲಿಕ್ಕೆ ಒಂದು ಅವಕಾಶ ಸಿಗುತ್ತೆ.
So this is a very important meeting held every year of the Huntington Disease Society. Huntington's disease is a very serious disease. It's a rare disease. It is biologically getting to be better understood. Genetically it is understood. And by working together with NIMHANS and all our research institutions, treatment is possible, but it's a tough job, but we can do it. I'm Vijayraghavan, former Principal Scientific Advisor to the Government of India.
I'm Venkateshwara Kaushik, Chairman for the Huntington Disease Society of India. So we have formulated this Huntington Disease Society 2019. Of that we had a conference before formulating. This is first event, really with second series in the conference. The main idea is like bring the advocacy to the people aware, the doctors, caretakers, people aware that there is a platform we are trying to create. Okay, this Huntington Disease Society exists and they support. So we provide the medical support for the some below poverty people like that. Somebody is sponsoring funds. We are trying to provide the medicines to them, as well as we are trying to provide some financial support. So this is we are creating some model so that the government can take over of that. So we have been requesting to government of Karnataka to establish a multidisciplinary care unit. So that's a role model for the entire country, so that it can give the take care, because most of the families know the generation 5 generation people are suffering with the disease and they are not able to, they are losing their hope. So that's one thing. We need to collaborate, not only Indian people, we have to collaborate with other people who are working. The clinical research should happen in India also. We are not doing right now, and some patients are interested to participate. The government should give a way forward how to participate. Even somebody want to take samples, we should get a clearance from the government to participate. That modality need to work out. Other one is like I have been saying, that palliative care facility. People who are all been suffering, like cancer patients, we have it. Okay, so the palliative care facilities in different places are there. India, we don't have anything neuro disorder. Not only for the Huntington disease alone, any neuro disorder, they are suffering. People are not able to manage, so they are have a difficult time to manage the things. Other one is like a Western country, it has been recognized as a rare disease. We've been calling rare disease, but still it is not been given a rare disease official designation. That is the reason people are hesitant to support by government officials, because there is a what is it, national level they have been formulated policy, a rare disease policy, but still there is a medication is not available. That is the reason they are not accepting this disease as a rare, but it's a rarest rare actually, that way if we say. So Dr. Sanjeev Jain can speak more about that.
Patient of Huntington disease, and then last about 7 or 8 years back, it was diagnosed through Huntington through the genetic test. Before that, I was all normal, just like you people. I had a wonderful career. My Huntington disease was diagnosed at the age of 69 years, and before that I had no problem, but once it was diagnosed, immediately there was the movement was not severe, so it was little not too much, and then my neurologist doctor told me that you are Huntington positive. Unfortunately, there is no cure for that. So, in spite of that, for nearly 6-7 years, I was able to do lot of normal work like cycling, driving, social work, and I am also, even now I am help attending a help desk at Victoria Hospital 3 days a week, and then so but anyway, all the patients are not fortunate like me, and then as a social activist I am fighting for public transport in the city of Bengaluru, mm, instead of car specific mobile transport. I am also a volunteer at a group called Citizens for Bengaluru, which has got about 4,000 members. We were instrumental in bringing suburban rail to Bengaluru, and then I am also running a campaign all alone for a footpath in Bengaluru. Unfortunately, because of road-centric mobile infrastructure development, yeah, right, yeah. So that my 7 or 8 years campaign has resulted in going to High Court. I have my petition, public interest litigation is registered in the High Court of Karnataka, and the case is going on. In spite of all that, I am still continuing my whatever to the best I possible, because I wanted to do something for the society till my life.
Dr. Sanjeev Jain. I'm a psychiatrist and I'm researching Huntington disease for 30-40 years. And I've been looking after patients at NIMHANS for 30 years. And it's a rare disease, but it occurs in the same way in India as it occurs anywhere in the world. It can start even in children. And you just spoke to another patient whose problem started at 65 plus. But as of now, we have no treatments. For many years, patients remain completely all right, and then slowly the movements develop or a psychiatric problem develops, and then very slowly or rapidly deteriorates into dementia. Patients need very extensive care. They need help with eating, they need help with toileting, they need help with walking, they need help with handling their accounts. So the whole family gets involved in the care, and if people don't have families or if it happens at the wrong time, then it is a real burden on everyone. We can develop better systems of care, better hospital care, better hospice care, better social work, and symptomatic treatment with regular follow-up with doctors and psychiatrists. So it is a problem which needs constant attention, and because there are almost 1 million people in India affected by this, something needs to be done as soon as possible. It is a genetic disorder, so 1 million people will have 10 million relatives, and these 10 million relatives can develop the disease in the next generation. So you have to plan for this disease, you have to develop better methods. Most importantly, the scientists and the clinicians and the families have to collaborate so that we can fight this disease together. Thank you.
ನಾನು ಪ್ರಸನ್ನ ಶಿರೋಳ್ ಅಂತ ಕೋ-ಫೌಂಡರ್ ಅಂಡ್ ಎಕ್ಸಿಕ್ಯೂಟಿವ್ ಡೈರೆಕ್ಟರ್ ORDI ಆರ್ಗನೈಸೇಷನ್ ಫಾರ್ ರೇರ್ ಡಿಸೀಸ್ ಇಂಡಿಯಾ. ನಾವು 7,000 ಡಿಸೀಸ್ ಇದೆ ರೇರ್ ಡಿಸೀಸು, ಅದೆಲ್ಲದ್ರ ಬಗ್ಗೆನೂ ಅಡ್ವೊಕೇಸಿ ಅವೇರ್ನೆಸ್ ಇದ್ರ ಬಗ್ಗೆ ಕಾರ್ಯಕ್ರಮ ಹಮ್ಮಿಕೊಳ್ತೀವಿ. ಅದರಲ್ಲಿ ಇವತ್ತು ಹಂಟಿಂಗ್ಟನ್ ಡಿಸೀಸ್ ಸೊಸೈಟಿ ಆಫ್ ಇಂಡಿಯಾದಿಂದ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಇದೆ. ಅದ್ರ ಜೊತೆಗೆ ಭಾಗಿಯಾಗಿ ಈ ಕಾನ್ಫರೆನ್ಸ್ ಬಗ್ಗೆ ಸೈಂಟಿಸ್ಟು, ಮೆಡಿಕಲ್ ಫ್ರೆಟರ್ನಿಟಿ ಅವರು ಮತ್ತು ಪೇಷಂಟ್ಸ್ ಎಲ್ಲರೂ ಸೇರಿ ಅದ್ರ ಬಗ್ಗೆ ಡಿಸ್ಕಷನ್ ಮಾಡಿ ಲಾಂಗ್ ಟರ್ಮ್ ಅಲ್ಲಿ ಏನ್ ಪ್ಲಾನ್ ಮಾಡಬೇಕು, ಏನು ಯಾವ ತರ ಈ ಡಿಸೀಸ್ ಕಾಯಿಲೆ ಜೊತೆಗೆ ಯಾವ ತರ, ಯಾಕಂದ್ರೆ ಇದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲ, ಅದನ್ನ ಇದ್ರ ಹೊಂದಾಣಿಕೊಂಡು ಮಾಡ್ಕೊಂಡು ನಾವು ಸಪೋರ್ಟಿವ್ ಕೇರ್ ನೋಡ್ಕೊಂಡು ಮನೇಲಿ ಯಾವ ತರ ಇರಬೇಕು, ಬಟ್ ಸೈಂಟಿಫಿಕ್ ಅಡ್ವಾಂಟೇಜಸ್ ಏನಿದೆ, ಹೊಸ ಹೊಸ ಆವಿಷ್ಕಾರಗಳು ಏನಿದೆ ಅದ್ರ ಬಗ್ಗೆ ಚಿಂತನೆ ಮಾಡಕ್ಕೆ ಈ ಕಾನ್ಫರೆನ್ಸ್ ಹಮ್ಮಿಕೊಂಡಿದೆ.
मेरा नाम संकेश बयानी है। मैं अभी 18 साल का हूँ एंड पुणे से आया हूँ मैं अभी। तो अभी मेरे को जुबिलियन हंटिंगटन का डिसीज है। तो इसमें क्या होता है कि बचपन में ही ये हंटिंगटन का ये डिसीज आ जाता है। तो हमको गवर्नमेंट से क्या चाहिए, मतलब इस अवेयरनेस की लोगों को पता होना चाहिए, कि मतलब उनको समझना चाहिए। अगर मैं गिर जाता हूँ, मेरे मूवमेंट्स होते हैं, तो लोगों को लगता है मैं पी के बैठा या वैसा कुछ होता है, कुछ मिसअंडरस्टैंडिंग हो जाती है। तो वो एक चीज है जो मैं गवर्नमेंट से रिक्वेस्ट करना चाहूंगा कि आप लोग हमें समझे कि हम क्या गो थ्रू कर रहे हैं। बिकॉज एक ऐसे डिजीज में रहना जिसका कुछ क्योर नहीं है, इट्स रियली डिफिकल्ट टू वेक अप एवरी डे कि आज होप ही नहीं है इस चीज का, या फिर कल नहीं होगा वैसा करके। बट स्टिल मैं गवर्नमेंट से वही करूंगा कि प्लीज आप लोग जितना हो सके सभी लोगों से कि आप अवेयरनेस रेज करो इस डिजीज के बारे में, ताकि सबको पता चले, ताकि हम सब मिलके वो जो मिसअंडरस्टैंडिंग है वो दूर हो जाएगा, कि लोगों को समझ में आ जाएगा कि ठीक है इसको एक डिजीज है, हम इसको एक स्पेस देते हैं वैसा। थैंक यू।
Hi, so I'm Dhaval Shah from Pune, and basically Sankesh के मामा हूँ मैं. So we have a family history for this particular disease, and basically I want to see this person, means whatever person who is going through this pain and this dreadful disease, so as a person and not as a as a patient or anything, because everyone is equal. Everyone is is very well, means आप उनको अलग नहीं कर सकते कि भाई आप ये कोई उसको हैंडीकैप बोलता है, कोई उसको ये बोलता है. So don't do that. You should keep them as a equal person and give them equal opportunity. किसी को चलने में तकलीफ होती है, किसी को बोलने में तकलीफ होती है, किसी को सांस लेने में तकलीफ होती है, खाने में तकलीफ होती है. Being मेरे फैमिली में है, मेरे को नहीं है, मीन्स मेरे को I won't be able to understand. I am positive, but it's asymptomatic. So I want कि पब्लिक उसे डरे नहीं, चीजों से डरे नहीं, बोल सके. ओके, जितना आप स्प्रेड आउट करोगे, कि जितना आपका मेंटालिटी आप पॉजिटिव रखोगे, यू विल बी स्ट्रांग इनफ. बट फॉर दिस फ्रॉम गवर्नमेंट व्हाट आई कैन आस्क इज, माय सिस्टर इज in a severe condition and she is going through lots of pain and everything. So can we get assistance for death, basically, because she is on the critical situation जहाँ पे bed rest है, total bed rest है, and there is no help. So she's been going for long now, for 7 years. So is this option possible in India? Because this particular cheese is available in Europe. Basically आप स्विट्जरलैंड में जाओ या जर्मनी में जाओ, you can get that thing. But for her, going through a pain and that particular situation is very harsh. So from that side, I would like to ask government कि भाई let us consider and at least एक government check approval ले सके कि if that if they are open to take this option, it will help us out. Thank you.